Today we will talk about computed tomography, CT. My name is Ahmed Nazal and I'm a medical doctor with training in radiology, so let's start. CT or CAT scanners were first introduced in the 1970s, and we're seeing here Sir Godfrey Newbold Hounsfield, who is an English electrical engineer who won the Nobel Prize for Physiology and Medicine with Alan Cormack for his part in developing the diagnostic technique of computerized axial tomography, or CAT, also referred to as computerized tomography CT scans. In this technique, information is obtained from X-rays taken in this device and the gantry, which are rotating around the patient and are combined then by a computer to yield a high resolution image of the slice of the body. A CT image consists of a grid of numerous small squares known as pixels, where each pixel is assigned a CT number ranging from -1000 to +1000 in Hounsfield units. So if there's a highly dense substance, there will be more X-rays absorbed and it will appear whiter, denser, and you can describe it with saying high attenuation. And if you imagine it as a forest that is highly dense, it absorbs a lot of X-rays or a lot of rays, and you can describe it with saying high attenuation. If it's low dense substance, it will absorb less X-rays and it will appear blacker, and then you will say low attenuation. Another important concept to understand or to be familiar with is windowing, which is a form of post-processing. So CT scans can be windowed in a way that optimizes the visibility of different types of pathology after obtaining the images. So this is a form of digital manipulation of the data acquired in order to view certain aspects of the data, to see the tissues differently, which will make recognizing certain pathologies easier and without repeating the examination, so you don't have to expose your patient to radiation again. And in windowing, there are two sub-concepts that are mentioned, which is the window width and the window level. I just added to the links just to make it easier to memorize. So window width and window level. The window width controls the contrast, while the window level controls the brightness of the image. And as far as I understand it, there is an inverse relation between the window width and the contrast and the window level and the brightness. However, practically, most systems you will be working with will have presets, and you can just choose from those presets depending on the examination that you're performing. So if you're looking for a fracture in a bone, you would choose the bone window. If you don't have it already saved in your system, you can look it up, for example, in multiple publications, and you can see the different values for the width and the level. You can insert it and save it and then use it later on. So this is an example of the bone window, and we're looking at an axial view of the chest. So you can see here is anterior, is posterior, and that's the heart. Those are the lungs. And in the bone window, you will be able to view the bones and see if there are any fractures, for example. This is the same image, so the same data, but with a different window, and you can see it looks completely different. And now you can view the parenchyma of the lung. So you can see any parenchymal changes in the lung better. So if you have a neurological patient and then you perform a CT of the head and then you want to see the brain, you could choose the brain window, and you can see here the left side has some areas of hypodensity or low attenuation. And if you want to increase the contrast here, you would decrease the width, and there's a specific one with lower width that will increase the contrast, and it's called the stroke window. So yeah, that's windowing, and you will come across it. But as I said, practically you'll have all the presets saved and you can use them. But it's good to understand the concept behind it. Finally, CT scanners are widely used, but they utilize ionizing radiation to produce their images. So it's similar to the conventional radiography. X-rays, they cause mutation, and they are teratogenic in times such as pregnancy. So that is why it's always important for the radiologist to talk to the patient before the examination and make sure that a female patient that she is not pregnant, and that the patient understands the risks and the benefits of the examination. So I hope you benefited from the information presented, and I thank you for your time.